Welcome to Reach Parent Module 4, Caregiver Emotional Health. When your adult child was injured, not only did he or she experience a loss, your entire family did. Whether the impact on your adult child is physical, emotional, or both, you've all gone through the loss of his or her previous self. As a caregiver, it is normal to struggle emotionally under the day-to-day responsibilities of helping your loved one recover and move forward. The emotional ride can be like a roller coaster. Some days are good, others are not. This module addresses these normal emotions and ways to manage them. By accepting and managing your emotions, you can reduce your stress and the toll it takes on your own physical health. Loss can cause very powerful emotions. You may have lost the adult child you once knew despite the fact that he or she is alive. Your adult child lost some level of health. Your loved one may have undergone a personality change or may be coping with anxiety, nightmares, paranoia, or depression. It is difficult to experience these changes in someone close to you. You may feel you've lost your old life. Change is difficult and caretaking is difficult. You may not be able to do all the activities you once enjoyed as often. You may have lost a job or income because you need to be home with your son or daughter. Your vision for the future may also feel lost. All of the things you hoped for you and your adult child's future may be in limbo or may seem unrealistic now. It's okay to mourn things we have lost. However, just as with the death of a person, we adjust over time and then move forward. Loss is sad and it's normal to mourn things that are lost. Don't feel guilty for feeling a very human emotion. You may go through stages and finally come to terms with it, allowing yourself to have new hope and new optimism. The emotional journey through loss takes on a very predictable pattern in most people. You may be able to recognize it in yourself and those around you. Know that going through this cycle is normal. By knowing the stages of grief and loss, it may help you see where you are on your journey and how far you've come. Often the first stage of grief or loss is denial. We do not want to believe a tragedy has occurred. We don't want to believe the doctor's prognoses. We don't want to believe the things have changed or cannot be changed. We struggle to process the traumatic event and desperately want it to be untrue. This often can lead us to anger. It is also normal to be angry about something traumatic that has happened. The word anger is actually derived from an Old Norse word, angra, which means grief. Anger is a natural reaction to pain. The pain can be physical or emotional. We may be angry at the person or people who did this to our adult child. We may be angry at ourselves or others for not protecting him. We may be angry that our world has altered and seems out of control. We may be angry at doctors for not being able to magically fix it. We may be irrationally angry at ourselves for not preventing it. If you or people around you are angry, know that this is a way of coping. It will pass over time, and if it does not, a mental health professional can help. The idea that you could have done something differently to change the present situation can cause guilt. This is not rational. You may feel guilty for being whole and healthy. You may feel guilty when you get upset about the impact of your loved one's injury on your own life. You may feel as though you are not providing your loved one with the best care possible and feel guilty about that. You might feel guilty about getting angry or frustrated with your loved one. Try not to let guilt get a hold of you. Being overwhelmed by caregiving is common. Getting angry and frustrated is common, and you should never feel guilty about things you have no control over. In caregiving, it's often one day at a time, and you do the best with the strength and emotional energy that you have. Don't feel guilty about that. The next stage of grief or loss is bargaining. People often experience this when a loved one becomes terminally ill. You may bargain with God or your higher power. If you will just heal my child, then I will dedicate my time to doing your works, or I will become a better person. You may bargain with doctors. There must be other surgeries or medications. What can I do to find the answer? You think about things you would do or give up to take away your loved one's pain or restore them to normalcy. This is a normal feeling during a time like this. Although we will address clinical depression later, understand that depression in the cycle of grief is different. After we move through bargaining and realize we can't change what happened, we become extremely sad. This sadness can color everything in our world. You may not want to leave the house. You may be uninterested in things you used to love to do. You may not want to see your friends. The sadness can shut you down. This phase of grief may take days or weeks to lift. However, if you remain depressed after 2 or 3 weeks, let your mental health professional know because there are things that can be done to help you through this. The last phase of grief or loss is acceptance. You may have gone through the previous stages slowly or quickly or even skipped one. Whatever the pathway, grief usually subsides when we reach acceptance. When you arrive here, you feel more calm, more future-oriented, and more able to accept what has happened. You move toward a focus on all the things you can do to improve the future. Everyone gets to this stage in their own time. Your loved one may still be in a particular stage as he or she grieves the changes combat inflicted. Your family members may be working through their own emotions as well. Give each other a little space and understanding, and be kind to yourself and to one another. Acceptance is a great place to arrive at because it brings us around to reality. Being realistic about your loved one's recovery, what the future holds, and what can be done each and every day to help your loved one recover is key. Things are going to eventually be okay. They may even be great. Let go of things you have no control over and focus on all the things you can do and all the choices you have. Talk to doctors and therapists so that you and your loved one have realistic goals to work toward in healing. You may need goals along the way to cope with your own emotions and stress. When we remain realistic, we can achieve more and feel more in control of the situation. Communicating with others is perhaps one of the greatest ways we can manage our challenging emotions. Talk about your feelings and worries with someone you trust. Just sharing feelings can be healing. Talk to doctors and get answers to questions. The unknown causes stress. Having answers relieves stress. Talking to a therapist can help you work through challenging emotions and help you find ways to bring more peace and joy back into your life. Do not isolate yourself. Humans are social beings and we depend on each other emotionally. You don't even have to talk about your emotions. Simply spending time with a friend talking about current events can give you a sense of normalcy and focus on something other than your struggle. Be patient with your loved one. Be patient with others who mean well, but also be patient with yourself. You may lose your self-control from time to time. Not all days will be great, and that's life. Everyone has good and bad days, and when people are recovering, these days can be really good or really bad. Your adult child is most likely struggling. Friends and family may make unhelpful comments and struggle to understand your experience as a caregiver. Be patient. Take a deep breath. Everyone copes in their own way. Slow down, take your time, And remember that no one person can do it all. In contrast to getting upset and angry, some people suppress or bottle up their emotions and try to appear as if everything is okay. This is not healthy. This practice can have a negative impact on your health, disturb your sleep, cause headaches and stomach aches, and shut you off from the world. If you feel like crying, cry. The human body incites us to cry when we are in physical or emotional pain because the act of crying releases calming, pain killing endorphins from our brain. Some crying is good for you. There is no shame in expressing emotions, even negative or sad ones. When you let the emotion go, it will have less power over you. If you feel like crying daily for more than a couple of weeks, this could indicate depression. And if this is happening, let your mental health professional know. Bringing humor back into your and your loved one's life is important. When funny things happen, laugh. Watch some comedic movies or TV shows. Laughing helps release emotion and helps our bodies heal. You can stream funny comedians online and watch hilarious videos. You can watch comedy channels on TV or your favorite programs you already know are funny. There is humor and laughter in the world, and you need to make sure it still has a place in your home. We reviewed the importance of physical health in the previous module, but it bears repeating. Taking care of your physical health helps you manage the challenging emotions of caregiving. When you are rested and healthy and more relaxed, it's easier to deal with difficult emotions and bad days. Feed yourself healthy food. Make sure you get 7 to 9 hours of sleep each night. Take a walk every other day. Drink plenty of fluids and take any medications you are on. Don't skip your own doctor's appointments. Taking care of your health also makes it easier to take care of your loved one's health. Keeping the two of you as physically healthy as possible will help you be as emotionally healthy as possible as well. Your loved one most likely has recovery goals set by a doctor or mental health provider. What goals do you have for yourself? You may have given up some enjoyable things when you took on the caregiving role. You may have let your own health or your social life go. Your relationship with your significant other, if you have one, may have been affected. Just as your adult child needs goals to move forward, you need them too. Do you want to exercise more? See your friends more? Go back to a hobby or craft you used to enjoy? Set measurable, specific goals for yourself and create deadlines for taking steps to reach those goals. Even baby steps are better than no steps at all. Progress toward and achieving goals relieves stress and help you feel emotionally healthy. Your loved one's doctor can direct you toward caregiver support groups that can do wonders for your morale. You can also learn coping strategies from other parents and spouses who are going through what you are going through. It is difficult to get empathy from people who don't really understand your experience. Meeting with, talking to, and listening to other people in your same situation can be a relief. It can be uplifting. It can be something you look forward to. These groups usually share practical ideas for working with your adult child as well as ways to deal with emotions. Just having an empathic listener can be all you need some days. You may have some tips to share that could make somebody else's life easier as well. It's normal to feel unappreciated when you've been taking care of someone for weeks or months on end. Your loved one may be too overwhelmed with his or her own emotions and struggle to notice yours. Many outsiders have no idea how difficult caregiving can be. Your loved one may even push away your attempts to help. Sometimes you may need to pat yourself on the back. Remind yourself what a great, important job you're doing. You know how much you are giving up and how much you do. Having a support group and confiding in your friends can be very helpful in dealing with this emotion. The longer you are a caregiver, the more isolated you may become. Friends may have stopped calling since you are rarely available. You may feel out of touch with their lives because you have a lot to focus on with caregiving. Remember, it's important to get out of the house. The doctor or hospital may be able to provide you with respite care if you cannot leave your loved one alone for very long. You might find a family friend to come sit with your loved one or just be present in the house while you go out. Getting out and seeing people or just going to a movie is essential for your mental health. At times, we get upset because of poor communication. You may not be the best communicator. Your adult child may not communicate well. This can cause misunderstandings and hurt feelings. Communicating with someone recovering from a physical or cognitive injury can be very difficult and stir a lot of emotion. Sometimes we fall into negative communication patterns without even realizing it. To have effective communication, there are behaviors to avoid when you talk to each other. The first to avoid is not being attentive. When talking to someone, it's easy to get distracted by other things, a chore, the phone, the TV, or just worrying about something else. When you and your loved one are talking, remove the distractions. Pay attention to what the other person is saying. Are you listening carefully without interrupting? Are you listening for the feelings behind what is being said? Tune into the speaker and tune out everything else. When you're having a conversation with someone else, are you keeping an open mind? Being close-minded means you are making assumptions, passing judgment, and missing out on opportunities to build respect. Being willing to try and understand each other means keeping an open mind. It also means withholding judgment. If you've already decided whether someone's actions are right or wrong, or decided how other people should act, you're judging. We each have our own struggles, and judging how other people handle theirs is unfair. Another closed-minded state involves rejecting. Not literally rejecting your loved one, but rejecting his or her feelings and wants as valid. When you reject other people's feelings and thoughts, they will stop sharing with you and close down the communication. So, you're trying to have an open mind, trying not to judge or reject feelings, but what are your words saying? Don't be vague or beat around the bush when talking with someone. Be clear and specific. Don't use your words to blame or criticize each other. Placing faults or criticizing each other will damage your relationship. Do you politely make requests of one another, or do you demand things and order each other around? Being polite and respectful with each other is just as important at home as it is in public. Try to be understanding and supportive with your words instead. Dealing with challenging emotions is a part of caregiving, and because of this, you are at a high risk for clinical depression. Besides sadness that does not decrease after 2 or 3 weeks, there are other symptoms of depression. These symptoms include feeling guilty, hopeless, helpless, or worthless, losing interest in ordinary activities including sex, sleeping too much or too little, experiencing an unexplained weight loss or gain of 10 pounds or more, feeling tired, restless, or irritable for extended periods, being unable to remember things or make decisions, having frequent aches and pains that treatment does not help, having thoughts of death as a release or that people are better off without you. If you are having these types of suicidal thoughts, get help immediately. Call 911 or 1-800-273-8255 and then press 1 for military. You need to get help now. There are many causes of depression, and doctors know that it tends to run in families. Some medications can cause depression. A chemical imbalance in your body may cause it. A traumatic life event, a chronic illness, chronic use of drugs or alcohol, or any combination of these triggers can cause depression. Seeking help from a doctor is important to determine the cause of depression and to choose a course of treatment. There are things you can do to help yourself with depression as well. When you are struggling, ask for help. Ask for help with your caregiving and ask for help from a doctor to treat your symptoms. Be sure to talk about your feelings with other people, a friend or family member, someone at your place of worship, a support group, or a therapist. Take care of yourself and get plenty of rest. Take time to make yourself look nice each day. Avoid drinking alcohol to cope or relieve stress. Push yourself to stay involved in activities you enjoyed before the caregiving began. Try to get some exercise. It releases endorphins which fight depression. And try to have reasonable expectations for yourself. Don't hold yourself to an unattainable standard. You deserve to be healthy and you deserve to feel good too. Being a caregiver is a difficult role. It can be physically, mentally, and emotionally exhausting. Dealing with a range of challenging emotions while caregiving is normal. Understanding that what you feel is normal can help you feel less alone in your experience and more in control of the situation. Take time to take care of yourself. Take care of your health. Take care of your social life. Take care of your emotions. Remember that each day is a new day and that as your loved one recovers, you will grow and recover too. Don't try to go it alone. Having a strong support group is vital for your well-being. Our next module focuses on building and maintaining that support. This concludes our module.